we are live, guys. We are live, we are live. Hello, welcome to my live video. This is going to be a very, very short one. I didn't really plan to be here, but it's the end of October, people. Welcome, welcome, welcome. I know right now there's nobody waiting over there, but I'll go ahead and get started. Welcome, join me on this Thursday evening. And I have with me, I don't know if you can see, it's a beautiful map here. Pink is not just a pretty color. So we are all aware it's Breast Cancer Awareness Month. And the least we can do is educate each other about this deadly disease that if caught early can be very, very beneficial. So welcome, welcome, welcome. I'm waiting for at least one person to join me. My name is Claudine. If you're joining me for the first time, welcome. I'll not wait for too long because I don't want this video to be long. I'm going to be here just for a few minutes. That's what I really plan for. And hey, after this, I'm going to be cooking. So I'll probably go live again. Just so you can join me in prepping my meals for this long weekend. I work as a nurse practitioner, and this coming my long week. And when I say my long week, pretty much weekend. So I work Friday, Saturday, Sunday, 12-hour shifts. And one thing that helps me sail through this is having my meals prepped. And something really funny is that my family and I, we don't have the same taste when it comes to food. I'm that person who's not scared to try anything. No, not anything. I'm not scared to try some of the things, but my family doesn't. So sometimes I make these things that I eat by myself. But then by the end of the day, it's having something that can keep me going for the shift. So I see two people on board. Please don't leave. Okay. My name is Claudine and I am a nurse practitioner. I work in a long setting. And yes, so this coming weekend, I will be working a 12-hour shift, Friday, Saturday, Sunday. So I will be prepping my meals here in a little bit, but I figured I'll go live right now. And I'm just going to talk about breast cancer in men. It's Breast Cancer Awareness Month, and it's the last day of the month. So I really didn't want this to end. Last year I had a video on breast cancer awareness, but I mainly focused on females. But did you know that 1% of breast cancer cases are related to men? Yes, it's very rare, but it's very, very possible to get breast cancer as a man. So if you're a man on this video, or if you know any man on that's related to in any way, shape, or another, please share this live video with them and just let them be informed that breast cancer in men is very possible. And right now I'm drinking from this cup. There's other reflection, but this cup says pink is not just a pretty color, or pink is more than just a pretty color. So it has some signal with it, some educational content, some reminders that breast cancer is a deadly disease. So let's talk a little bit about some statistics. So in the US alone, there are about 2,500 new cases of male breast cancer diagnosed every year. And this is roughly 500 men that die from breast cancer annually. So that's a very large number when you look at it. Most of the time we've just associated breast cancer with females, but over the years we need to educate ourselves, we need to educate the men that this is also possible in men. Um, so it's good to know what your risk factors are. So the first risk factor we'll talk about is age. So most cases of male breast cancer occur between the age of 60 to 70. And this is just statistics, but there are different factors that can make you have breast cancer even outside this window. The other thing is family history and genetics. So if you have family history of breast cancer, whether it was your mother, your grandmother, or even your grandfather, your father, that's one other risk factor you really need to watch for. The other factor is hormonal imbalance. So high level of estrogen. This can either be due to occurrence in the natural nature or rather naturally, and the other is due to hormone treatments. So if you go through different treatments with estrogen, know that that can increase your risk factor for breast cancer. The other is radiation exposure. So this can happen in different ways. If you get frequent x-rays, you go through different radiation treatments for whatever reason, and mainly around your chest area, this is going to lead to increase in your risk for developing breast cancer. The other one is liver disease. So liver disease is another factor that can lead to higher risk of breast cancer. And these risks are also for both females. So it's not just for men. The risk factors and all the symptoms we're going to talk about, these are also on females. My main goal today was to let the men out there know that breast cancer is also common in men. So before we end this month of breast awareness, let us remember that breast cancer can happen in both females and males. So you're probably wondering, how can you tell or how can you know some of the signs and the symptoms of breast cancer? I see we have a few people watching. Camden, hey, I'm not sure I'm pronouncing that right, but hey, welcome to my live. And I hope you learned something from this. Somebody's asking my age. Yeah, I'm on the 4th floor. That's all I'm going to say. So, signs and symptoms of breast cancer. So these are some of the things you can watch for, both in females and in males. A lump in breast area, changes to the skin color. Most of the time it's discoloration around the nipple area. And nipple discharge. Do not take any kind of discharge lightly. This is one of the things that can really help you. And in fact, most people usually start out with all right, I was trying to share that to my Facebook page. And for some reason I lost the screen. The other thing is changes in nipple shape. So this can be inverted or retracted nipples. So a nipple should be like pretty much straight, if I'm making sense. But when it's inverted to the point that the nipple area dimples in, we call it nipple dimpling. That's a really good warning sign that can let you know that, this is not normal. I need to seek some care. Another thing to watch for is swollen lymph nodes. This swelling of the lymph nodes mainly are under the arms, and this can be a sign that breast cancer is spreading. So if you notice any of these 5 symptoms we've talked about, please seek medical care so you are evaluated and they can do what they need to do. And that moves me on to the next part, which is the assessment and diagnosis. So there are major ways in which they can assess and diagnose if it's really breast cancer or not. So the first thing they talk about is clinical examination. So you've done your own examination and you've seen that there's something not around here. So you've taken a look, you've seen maybe you have a discharge, you felt a lump, you've seen some discoloration around your nipple, you've realized there's some change in the nipple shape. The next thing you need to do is seek medical advice. Call your doctor and schedule an assessment. So your first part is a clinical examination. So your provider will definitely do an evaluation to make sure what you're seeing is what they're also seeing, and vice versa. If once they do an evaluation, the next thing they move to is imaging. So there are two main types of imaging that are done. The first is mammogram. Most of the time, mammogram comes first. So if this is something in your mammogram that they realize that this is not normal, then they'll move you on to what's called an ultrasound. So ultrasound, it looks deeper into the tissue, into the breast tissue. So those are the two image examinations that you completed. Once that is done, then we'll move on to biopsy. And for biopsy, this is where a small piece of tissue, the sample, and they send that to the lab, and that's examined under a microscope. So this here is going to help them determine are these cancerous tissues or are these just benign? Benign meaning they're like scary, but they're not cancerous. So definitely you need to make sure you follow that. And the other thing they can do is genetic testing. I've not had much cases about genetic testing, but it's listed as one of those assessment and diagnosis that can be completed. Once that is done and they confirm it's breast cancer, what do they do next? So there are different options. They do surgery, they can do radiation therapy, chemotherapy, they can do hormone therapy, they can also do targeted therapy. So let us realize that breast cancer in men is a serious but often overlooked condition. And this is just a wake-up call that while it is rare, it can occur and its consequences are more severe if it's not diagnosed early. And this is because a lot of people are not educated on the possibility of breast cancer happening in men. So this is just like a short video to educate the community, to educate the population about breast cancer in men. That as we end this month of October, I plead with you that take this seriously. As a man, as a woman, breast cancer is still common and it's still one of the leading causes of death among people in the general population. And don't forget that 1% of breast cancer cases are those of men. So just to recap on the statistics, 2,500 new cases of breast cancer are diagnosed in men every single year. And roughly out of these 2,500 new cases, 500 of those people die from breast cancer annually. So that's a very high statistics. If your math is very good, 2,500 and then 500 out of those. So that's around 20%, which is very, very high. So I didn't want to make this video long, but we can hang out a little bit longer as I continue sipping on my coffee, and I'll probably go back live while I cook. Yes, I'm about to cook. This is coming weekend. It's a very, very long weekend, and I just want to get ready, be prepared for it, because you know what? It's lack of preparation that makes us fail. So one thing that I hate is when I have to work and then I have to come back and cook for meals for the following day. So I always prefer spending time the day before and just preparing some meals, something that I can carry to work. So yeah, oh my goodness. So if you're joining me, welcome. In this channel, actually, I've been talking about a lot of lifestyle, a lot of motivation things, and I've kind of taken a setback within the last couple of weeks, just a step back, just to really wonder what I really want for the channel. It's grown over the last 1.5 years, and I appreciate each and every person that tunes in, that watches my videos, and I I just need to make some sober decisions on what I will be posting on here. And I've had a couple of things in mind. I'll be doing a lot of education because that's what I love. I love teaching. And we'll be doing, I just need to figure out my schedule. I'll probably be coming on once a week live, just for Q&A, to talk, to hang out, and just to see what's going on. Hi, Glory Hair Care. Hello. Welcome, welcome. Yeah, I was just talking about breast cancer cases among men. As we wind up October, this was Breast Cancer Awareness. We are well informed about breast cancer in females, but we tend to overlook breast cancer cases among men. So this was just kind of short live video, but hey, feel free to join me later. In the next maybe 30 minutes, I'll be going live so I can cook, do a little bit of meal prep for tomorrow through the weekend, because I will be working. Yes, this is my weekend to work. This is my stressful week. And this week goes by so long for me because it starts on Monday. I work 2 days, I'm off 2 days, and then I work 3 days. So I always feel like I'm working the whole week because these are long hours. But yeah, I do appreciate the opportunity to have a job, to be able to make a difference in people. And I hope we can catch up again later. So stay tuned. If you are not subscribed, if you're not following me yet, please subscribe and let us learn together. Actually, going forward, maybe at the end of next month, I'm just trying to put some things together to see what really I'm going to focus on. I've been doing a lot of vlogs on travel. I've been doing some cooking. I've been doing some educational content, but I've gotten to the point where I need to like narrow down. I've seen what my passion is. I've seen what my viewers love, but I need to just try and narrow to one thing. So yes, thank you so much everybody for joining me, and I hope to catch up with you later. I didn't want this video to be super long, but I do appreciate each and every person that's on here, that tuned in, that was able to watch, even if it was just for 30 seconds. I really do appreciate you. And I am going to sign out, and yes, I'll catch up with you guys later. Thank you.